My name is Christine Miller, and I will be presenting a health plan for a patient with otitis externa, also known as swimmer's ear. First, we'll start off with our case study. Jay is a 17-year-old male who is on his high school swim team. He presents with sudden right ear pain that worsens at night. Along with the pain, he also feels fullness in his ear and it hurts to touch. With examination, yellow crusting is found in the auditory canal, which is also red and swollen. No fever is noted with a temperature of 98.7. Jay is experiencing what's called otitis externa, or swimmer's ear. As Jay is a swimmer, moisture is the cause of his otitis externa. Moisture in the external auditory canal elevates pH and eliminates the waxy layer. Removal of the waxy layer causes moisture retention and loss of protection. Aerobic organisms are the predominant pathogens for otitis externa. These pathogens are a part of the normal external auditory canal flora. They are increased with otitis externa. Fungal overgrowth is found with prolonged antibiotic use as well. For the treatment, you want to treat with analgesics based on the severity of the pain. Evidence is limited for steroid-only ear drops, but topical treatments are effective for uncomplicated otitis externa. Most topical treatments are equally effective, so other factors are considered when deciding which treatment is best. For example, some evidence shows that topical preparations that contain steroids and antibiotics versus preparations without steroids have reduced swelling, reduced redness, reduced secretions, and reduced analgesic consumption. The normal treatment for otitis externa is 7 to 10 days. Education is a key component of treatment so recurrent infection doesn't occur. Frequent washing of the ear should be avoided, along with cotton swabs being used inside the ear canal. As a swimmer, it is important for Jay to know he shouldn't swim in polluted waters, and he should ensure that his ear canals are emptied of water after swimming. He should also consider using ear drops with a 2-to-1 ratio of 70% isopropyl alcohol and acetic acid after each episode of swimming. For the medication application, Jay is a 17-year-old male. He can possibly do the ear drops by himself, but if family were to help, the first step is always to wash your hands. Secondly, you would instruct Jay to lie down with his right ear up, as that is the affected ear. Third, to mix and to warm the solution, you want to roll the medicine bottle between your hands. You want to pull the helix of the ear back to open up the ear canal. You would then take the top off the bottle, put the drops above the ear, and put as many drops as is prescribed. Then you would have Jay remain in the same position for 1 to 2 minutes before getting up. Put the top back on the bottle and store it in a cool, dark place. And then always wash your hands after treatment as well. If symptoms don't improve within 48 to 72 hours, Jay should follow up with his primary care physician. Alternative management, such as oral antibiotics, will be considered if symptoms persist longer than 2 weeks. If any complications occur, it is encouraged for Jay to immediately call his doctor or have his parents call his doctor. Thank you.